Well, first of all, I want to apologize for my French. It's my third language, so I will be grateful for your understanding. And I want to express the honor it is for me for being invited to this symposium. I have a great deal of admiration for the work of Dr. Julien, his team, and the Foundation. And I'm very appreciative of the opportunity to voice the work we're doing at The Voice, where we are involved in research and in the field to promote the recognition of the voice of the children. To start with, in this symposium, we asked ourselves, why aren't the children heard? This is something that was strongly developed yesterday, and I think that we understand the answers better if we look back in history. If we look at the status that the children were given throughout history, and it is somewhat discouraging if we look well at the way that the children were systematically objectified. They were characterized as positions in which the adults are judging their own fate. It's only in the early 1900s that child mortality became a real medical issue. Before that, the families had many children. Only a few would survive. Several were dying. It was a matter of fact. It was in a period of high urbanization where the governments, especially in Great Britain and in France, were concerned by the lower demographics and by the impact on the military strength of the nation of that lower demography. And so they relied on medicine to reduce the infant mortality and the value given to the newborn in that period was really focused on their capacity to contribute to the future of the nation. It was not out of benevolence or humanitarian concern. Children were things in which you wanted to invest for the good of the state. They were means. Several researchers, and even today, for instance, the sociologist Neckley will say that even today, if we look at the policies and practices, there is a trend in characterizing the children as human beings in becoming. Their real value is founded on their eventual contribution. Their value is linked with the pleasure that they can give a family. We are inclined in not recognizing their full dignity as human beings. Our team at Voice is a research and action group. We are an interdisciplinary, interprofessional group. I think I can claim that all disciplines and professions we can imagine that are interested in the children that are present in our group. We are interested in promoting both knowledge and practice to improve the recognition of the dignity of the children and promote their participation and making sure that they're genuinely listened to. We are using qualitative research methods, and it's interesting. It complements what was said this morning. There is a great deal of quantitative research available. We intend to bring some complementary knowledge based on the daily lived experiences of families and children. We have developed a conceptual framework anchored in the notion of moral experience, and we also developed an ethnographic methodology where we are trying to understand the daily lived experience of children and families in different contexts. all the context where they are, at high school, at grade school, in mental health, in community organizations, children with incapacities, for instance, among other things. So we're not exclusively a research team. We have a vision of an integrated research and practice approach. We have over 40 community partners who are working of our team at Voice, and it's with those partners that we're identifying our research for our priorities for research and action. So on what should we be working with our partners and with the children in order to promote their recognition and to promote respectful practices? I would like to add that amongst our community partners we have several youth groups. We have a Pan-Canadian Youth Commission. We have an advisory group of children with incapacities. We have young natives who are also an advisory group of ours, and so we're trying to live and implement this vision of recognition, and we want to commit ourselves in partnership with the young people. And we also have a global commitment. This recognition of the lived experience, this respect for children is underlining major issues at the global level, and therefore we have projects, and we've had projects for many years in native communities in Brazil, in Tanzania, in India, and this is major work with several other partners. Today, I would like to focus on childhood ethics in order to complement what was developed up to this point in the symposium, which we've been focusing on law. We think that an ethical framework can bring an essential complementarity, because we believe that ethics can provide a framework with more specificity for different contexts, more specificity for the various professions that are involved with the children, and generally speaking, I would say that ethics is calling for a higher level of commitment than what law would require. So the ethical framework gives us an opportunity to really fill an answer to most of the concerns that were developed in this symposium, and it's a framework that we can use to train various professions. To answer the question that we just answered, I would probably say that the preparation and training of the first line stakeholders, they have the responsibility to promote and prevent exclusions, to promote inclusion, respect, and the listening to the voice of the children. We published a few writings to promote this idea of integrating an ethical framework with a more legal approach. Let's take a moment to think about this notion of vulnerability. What are we talking about when we say vulnerability? It's obvious that the children are vulnerable at various levels. They're physically disadvantaged, they're smaller, less strong than the adults, they're psychologically disadvantaged, they have some knowledge and ways of reasoning that are typically different from the adults who are the dominant population. They're socially disadvantaged because they're economically dependent. They depend on the adults, on the rules that they have to follow. And they are legally disadvantaged, meaning that they are dependent on adults to exercise their own rights. Moreover, several children are doubly or even triply vulnerable because they are part of a group that is faced with even greater and more complex challenges. And so in this context of vulnerability, aware of all of these disadvantages that are part of the daily reality of the children, we recognize the importance of protection. So we have rights and we have procedures to protect the children and the young people. But very often, in many different situations, what we do to protect may turn into repression. We may suppress the respect and dignity of the children by trying to protect them. In a few words, I want to mention a research which for me was transformative. The anthropologist RedBlue Bond published in 1978 a research which to this day has a very strong impact in the interdisciplinary studies on childhood. She did an ethnographic study in Department of Pediatric Oncology with 3 to 9-year-old children, and she noticed that the adults, the parents and the staff were not speaking freely with the children about their diagnosis. This was very seldom that the word cancer was mentioned, and they were not even talking about death. And you could see that the children were not talking about cancer, were not asking questions about death, and therefore everybody was pretending to protect them. And the idea not talking about that with the children was to protect them. In this ethnographic study, so Blue Bond Langer, who's a partner of our team, she's a member of our team, she unveiled the fact that in reality those children had many questions, many concerns about what was happening with them. And they also had learned that the adults were uncomfortable talking about that.
And in fact, children were trying to protect adults from talking about cancer and death. And by trying to protect them, we actually isolated them. They were suffering, they had many concerns and preoccupations, and they had to struggle with that in solitude. So we always have to bear this in mind when we're trying to protect a child or a young person. Are we truly protecting them? Or are we repressing and excluding their voice and neglecting them? In the first 28 years of my experience, I worked full-time in a pediatric intensive care unit for 28 years. And within that context, we came up against many ethical dilemmas. And that's when I identified how it was important to obtain more knowledge and become a clinical ethicist for children. So gradually, I carried out ethical consultations in our hospitals as well as pursuing research. One thing that struck me was that when we're talking about ethical dilemmas, it was almost exclusively problems that had been identified by staff, such as the moral distress of the members of staff, or the big difficulties that the staff had to really decide what would be the right thing to do. There was very few voices of the children parents being heard. So in my daily life, I saw that there were many challenges in the daily lives of these children and family that we weren't really aware of. So we carried out research that was really significant for setting up voice. It came out in Pediatrics in 2006, and there we carried out research on the daily living of children who had very complicated physical handicaps. They lived at home with ventilators and so on and so forth, to try and see what were the ethical challenges for these children and families on a daily basis. The big surprise was that for these families, where the staff were asking questions about why have we kept these children alive, that have got so many handicaps. That's a word that I don't like, but the staff thought it's really not worth it. We should really stop the treatment for keeping them alive. But when it came to the children and the families, the biggest challenge was not a medical one, but rather it was the social obstacles that they were encountering, such as the stigmatization and the judgment of others that this child wasn't worth it. So we learnt that ethics and the daily living of the children and families were very far removed from the ethical dilemmas expressed by the staff and what the staff thought about this. And here we really gathered the viewpoint of children, where they see all of this, not the technology, not as a burden, but as a support, because it made their life more comfortable, even the ventilator. So that allowed us to better understand the daily lives of these children, and then we could understand better what is actually acting in the best interests of these children. We saw that with the members of staff, there were various prejudices circulating that this life wasn't worth living. And the concept of their best interests didn't actually ask for comments from the children living through this on a daily basis. So why should we listen to children? That's our question today. One of the possible answers is because it can actually complement and feed into and clarify and inform the way in which we can best define how we're going to act in their best interest. We have to look at their daily lives and what's interesting for them, what's an advantage and a disadvantage for them on a daily basis, and how can we maximize their best interests and at the same time minimize our prejudices about this. There's another very important reason as to why we should give children a voice and listen to them. And this is in fact the main objective of Voices for Children. We have to recognize that children are moral agents. They have a moral life. They have their own feelings vis-a-vis good and bad and what's fair and unfair. And they may have a very different form of reasoning from our reasoning, but ethically speaking, it is significant. And when we ignore them, when we don't listen to them, then they will find this to be a violent experience. We claim often to act in their best interests, and when this is not well understood, it can actually cause a great deal of harm. Children have the ability to understand far more than what we may think, and sometimes they have got abilities that are different from ours, but which are nevertheless significant and they therefore need to be recognized as moral agents. I'd also like to add, as one girl said in the video, that sometimes we can get clarification, understanding about ourselves when we listen to this other perspective. It can actually shed light on things for us as well as adults, because they've got a different way of thinking, they've got different knowledge, and that does not mean that they're ignorant just because their knowledge is different from ours. So in trying to promote voices, children, and to get them recognized as moral agents, you've got an example here of a project that we published, because for 10 years now we've been working in Algonquin, a community in the north of Quebec, and we work with children by setting up different workshops to deal with subjects that are important for them. That year was self-respect back in 2009. How can we show respect for our own bodies, treat our bodies in a correct and respectful way in harmony with values and the Algonquin world vision. So with these workshops, we really encourage these young people to think more and to express their thoughts, and then to make a presentation to the community, to help adults as well to better recognize how they can be a moral agent, and they have this capacity to act in terms of acting for good or for evil. And then a final point that I'd like to underline is that we have not made much progress, but we're trying to recognise children's voices so that their voices are heard in our daily work. And we try to improve the way in which we can promote this listening of children in order to promote respect and participation of young people. We have to see them as partners in governance within the different establishments. And when we structure our services, it might seem a little bit crazy, this, but there's various models that exist amongst our partners. There's the Holland-Burvey Readaptation Hospital in Toronto, where they have an advisory committee, which is really exceptional. And there they have representatives on the selection committee for administrators. They've got young people who are well trained and participate in this committee so they can really express their own views. And it's written into the rules of this institution that there needs to be validation from this committee before they establish important new policies, because at the end of the day, this is meant to meet the young people's concerns. We're also setting up an advisory committee in child psychiatry at Douglas Hospital, where I work, and also at the Shriners Hospital, where I'm also an ethicist. But we do need to make certain adaptations and some accommodation, if you like. We cannot use the same structures as those as we would use with typical committees. For example, we cannot have meetings with young people from 9 to 5 p.m. because that would mean that they'd have to miss school. So at Holland-Burvey, it's on a Saturday afternoon that they've got this meeting. There's a support person who is the bridge, if you like, a board member who establishes the right links with the hospital or the other institution. So we've taken several adaptive measures to ensure that we authentically listen in a respectful way to the voices of children when it comes to the governance of this establishment. And very quickly now, in certain situations that will come up where we don't all have the same viewpoints, perhaps the young person has one point of view, for example in a governance committee setting or in a clinical setting or in another context. The young person may have one point of view, the parents may think something else, or the parents may have a different viewpoint, and then the clinician may have another point of view. So how do we deal with that sort of situation? I put forward a framework for ethical practice, which I call the rapprochement reconciliation model, drawing on Charles Taylor, a Quebec philosopher, who was in the Bouchard-Taylor Commission on Reasonable Accommodation. So he's done a great deal of work on ethics and moral philosophy issues. So this reconciliation framework, or rapprochement framework, builds on recognizing right away the viewpoint of each participant in this situation. Each participant has their particular view and a commitment towards good or evil that's important for them. So there needs to be sharing and discussions from the outset, and there needs to be reconciliation that takes place so that we can evolve with this approach, so that we can have a maximum amount of understanding and reach agreement, while at the same time recognizing the most important values held by each of the participants. And in general, we give priority to those who are most vulnerable, namely the children's concerns. And on this point, I'm going to round off, and thank you very much for listening.